What are the requirements for this grand unified reform of our tax and healthcare system? First of all, we need to be able to control spending. The fastest growing source of spending for the government, and the one that really creates the big problems over the long term, is federal spending for Medicare and Medicaid, that is for health care. The CBO has these long-term projections, and by the year 2040 or so, spending on Medicare, Medicaid, and Social Security comprise about 18% of GDP. That is the historical average of total taxes collected at the federal level. We need to figure out a way to reduce that spending level. One of the concerns people have about the current tax system, and I think it's exacerbated by some proposals to create more refundable tax credits, like Fred's going to talk about, is that a lot of individuals don't owe income tax. And the concern is that from their perspective, federal government programs appear to be free. So another concern for reform, I would argue, is that lower and middle income people should be responsible for a share of government spending. A third concern, and this is raised by rising economic inequality. This was a big theme of President-elect Obama's campaign, and I imagine will be a theme of his administration, is that we need to maintain or improve progressivity. The tax system is one way of mitigating economic inequality. And another concern is relatively high marginal tax rates. In the last panel, Bill and John talked about high marginal tax rates on corporate income, 35% tax rate, even though revenues are relatively low. That's a higher rate than applies in much of the rest of the world. And conservatives in particular are concerned about high marginal tax rates on individual income as well. So an ideal reform would reduce those rates too.